Hi, welcome to another episode of Medicine Simplified. In this video, we will know about Fanconi Anemia. Please remember, this is an educational video for medical professionals and medical students. First described in 1927 by Guido Fanconi. It is a autosomal recessive or X-linked disorder. Most common is autosomal recessive. It is a rare inherited bone marrow failure syndrome characterized by pancytopenia, predisposition to malignancy, characteristic physical abnormalities, and congenital malformations. It involves defective DNA repair. Coming to the genetics of Fanconi anemia, there is a mutation in more than 22 FA genes, which are important for protein synthesis and DNA repair. Most commonly involved genes are FANCA, FANCC, FANCG. Leads to impaired DNA interstrand crosslink repair. So there will be disruption in DNA crosslink repair. ICLs prevent DNA strand separation and maintain DNA integrity. Coming to the pathophysiology, chromosomal breakage due to cells' inability to conduct repairs due to mutation in FA genes. Hypersensitivity to DNA damaging agents. Progressive bone marrow failure. Bone marrow failure of FA is thought to occur from selective destruction of CD34 plus stem cells. Coming to the clinical features, most common clinical symptoms of FA includes shortness of breath, chest pain, dizziness, and fatigue. And another symptom is pancytopenia, which leads to anemia, leukopenia, and thrombocytopenia. History of epistaxis, petechiae, and excessive bleeding from wound site, which is common due to thrombocytopenia. Growth retardation leading to short stature and congenital anomalies. Skeletal anomalies like hypoplastic thumb, hypoplastic radiate bone, light brown skin pigmentations, that is cephalot skin lesions, renal and cardiac malformations. Hypogonadism is commonly seen in both sexes and they are more prone to infections due to leukopenia. Coming to associated malignancies, FA patients have high risk of acute myeloid leukemia, myelodysplastic syndrome, and other solid tumors like head and neck cancers and gynecologic cancers. Coming to the investigation, first is CBC and MCV to diagnose pancytopenia, chromosomal breakage test, which is indicated in severe pancytopenia, cell cycle analysis, genetic testing for FA gene mutation, bone marrow evolution, and skull X-ray, in which we can find crooked appearance or hair on end appearance, which is commonly seen in hemolytic anemias. Here is the skull radiograph where you can find spine or hair-like structures around skull. The patient is suffering from severe anemia. Coming to the treatment and management, they need supportive therapy like PAC, RBC, and platelet transfusion, which can have immediate effect. Hematopoietic stem cell transplant, androgen therapy should be considered in patients who are not good candidates for HSCT, that is hematopoietic stem cell transplantation. And most preferred androgen is oxymethylone. And regular checkups for malignancy transformations. Coming to the differential diagnosis, acquired aplastic anemia, other inherited bone marrow failure syndromes like Diamond Blackfan anemia, which is pure red aplasia, Schwann Diamond syndrome, bone marrow aplasia associated with neutropenia, de novo myelodysplastic syndrome, and drug induced or infection associated pancytopenia. If you like this video, please subscribe to our channel. Thank you.